Dear friends, welcome to the show, Talk with Your Doc. I am Dr. Prashant Jani, and with us is today Dr. Zaki Ahmed. Dr. Zaki Ahmed is an intensivist and he is a chief of medicine at Thunder Bay Regional Health Science Center. And today we are going to talk about cardiac arrest. About 40,000 Canadians get cardiac arrest every year. Cardiac arrest is very common and it can happen to anyone, even our near and dear one, right in front of our eyes. It can happen to anyone at any place at any time. And it is very important to know about what are the signs and symptoms of cardiac arrest, what are the treatment options, and what is the prognosis in the case of cardiac arrest. So Dr. Zaki Ahmed is going to guide us about this. Thank you, Dr. Ahmed, for coming and helping us with the show.
Thank you for having me.
Thank you. So please tell us about the cardiac arrest. What is cardiac arrest?
So I think the most simplest way of understanding what a cardiac arrest is, it's clinical death. So basically a person has just died, and that's how serious a cardiac arrest is.
So what happens when somebody has a cardiac arrest?
So what happens is there's electrical activity that keeps going through the heart, and as that electrical activity gets either abnormal or becomes absent, the heart can't function as a pump. And because of that pump failure, you're not able to provide blood to the main organs of your body, the most important one being the brain. And as the brain doesn't get any blood flow, you end up having loss of consciousness, and you end up dying.
So person can get cardiac arrest, which is the electrical activity abnormality, and patient collapses right in front of you.
Exactly. So most of the time when you see someone lose consciousness, the first thing to actually do is to check a pulse. Mm-hmm. And people can lose consciousness and have a pulse, and that's not a problem. That's not a cardiac arrest. It's when you don't have the pulse that makes it much more serious.
So what is the difference between cardiac arrest and heart attack?
So a heart attack is a circulation problem. So if you will, it's a plumbing problem. Mm-hmm. And where a blood flow that goes around the heart and supplies the heart muscle, that's the blood flow that's being compromised. Whereas with a cardiac arrest, it's more of an electrical problem. So if you think of the two parts of the heart, one being the plumbing, one being the electrical, it's usually the electrical problem, which may occur because of a problem in the plumbing, but it's mostly an electrical problem, can't provide electricity to the heart to make it function well.
So is there any warning signs for the cardiac arrest, or it just happens all of a sudden?
So the warning signs are fairly unreliable. So you can have things like nausea, vomiting. You can have chest pain, which is most common symptom. You can have shortness of breath, but they're not always present. So sometimes you may not have any symptoms, and all of a sudden
somebody collapses right in front of you.
Exactly.
Is there any stimulating factor for cardiac arrest?
So there's definitely certain risk factors. So the most common risk factor in the world is coronary artery disease or heart attacks. Heart attacks can lead to electrical abnormality that causes the heart not to function as a pump together, and that can cause cardiac arrest. Then you may just have problems with purely just electrical problems, and those may occur either because of abnormality in your heart muscle. These may occur because of genetic problems, hereditary problems, and either way you will have a cardiac arrest.
So somebody who is like in age of 30 or 20 having no cardiac abnormality, no coronary abnormality, can suddenly collapse due to cardiac arrest.
Absolutely, and that is the one that we've learned over the last 20 years more about than anything else. Where you may have heard on the news recently, there's a family from Ottawa that's trying to raise money for devices which they're planning to put in schools. And that's because an 8-year-old child died in school during recess break. Mm-hmm. And this is reported over and over again, where young people, they have electrical abnormalities as well. And either it may be a genetic abnormality or abnormality with the electrical conduction, or it may be an abnormality with the heart muscle itself. Either way, if you have a cardiac arrest, you can have it when you're young as well.
So cardiac arrest can happen at the age of 7 to 8 years, right up to the older age group.
Absolutely.
Anybody can get cardiac arrest.
Absolutely. And that's why it's so important to know what to do when cardiac arrest happens.
So is there any investigation which we can do so that we know that somebody is probably prone to get a cardiac arrest?
It's very difficult. Obviously, the most common one is a coronary artery disease. So if someone has risk factors for heart disease, which is if you have high blood pressure, if you have diabetes, so any of those things. Some of your guests have already talked about those things, and any of those can cause your risk of heart attack disease, heart attacks to occur. And if you have heart attacks, you're at risk for having.
But somebody who does not have any of those risk factors, what should they do?
So usually it's symptoms. So as I said, some people may not present with any symptoms, especially the young people, and that's why it's often fatal in those ages, because it doesn't get picked up. But if you have symptoms, so if you're a child and you're getting short of breath for no particular reason, if you're having things like loss of consciousness or what we call syncope, those are the things that that should be investigated much more thoroughly. Now,
is there any different types of cardiac arrest?
Yeah, so there's cardiac arrest is clinical death. What causes it may be different. So if you have electrical abnormality where the electricity is just going in different circuits rather than going in the normal channel that it goes in, that can cause a cardiac arrest. If you have an abnormality with the heart muscle itself, it can cause those electrical conductions to happen much more frequently. Mm-hmm. There may be an absence of the electrical conduction. There may be times when there may be good electrical conduction, but that the heart muscle has undergone some problems due to which it can't contract. If you have the first problem, if you have just those electrical conductions, if you have those abnormal electrical conductions, you can shock. Okay, so that's what's called a shockable rhythm.
Shockable. Okay.
But if you have if you have a problem in the muscle, if you have a problem with if the muscle can't take the electrical conduction and change it into a pump action, that can also cause it. So unlike what you see in TV, where everything is a shockable rhythm, you see a flat line. Actually, in real life, that's not necessarily something that we shock for. So as I always say, don't believe everything you see on TV, except for what you see here.
Thank you, Dr. Ahmed. We will take a short break and we'll come back. Please stay back and we'll continue the show after the short break. Thank you. Welcome back to the show Talk with Your Doc. With us today is Dr. Zaki Ahmed, and we are talking about cardiac arrest. Dr. Zaki, you were mentioning about two different types of cardiac arrest, shockable and non-shockable. So how do you know which is one who gets what type of cardiac arrest?
Yeah, so it's that's a very interesting question. As someone who's actually seeing a cardiac arrest occur, there's no way to tell. So I have over 20 years of experience just dealing with cardiac arrests, and despite that, I can't tell just by looking at someone what kind of rhythm they would have. So it's really, really important to not depend on whether it's shockable or not shockable, but to do everything the same for everyone.
Okay. Now, as you were mentioning that there are various risk factors for the cardiac arrest. Mm-hmm. Now, who gets the shockable and who gets the non-shockable?
Yeah. So people who usually have heart attacks, they are much more prone to develop rhythm that's called ventricular fibrillation or ventricular tachycardia. Both of those rhythms are shockable rhythms. So majority of the people will have a shockable rhythm. Because majority of the people will have cardiac arrest secondary to heart attacks.
Okay. Now, so once somebody gets the cardiac arrest, what are the complications? What can happen to that patient?
So when someone has a cardiac arrest or when someone dies, the most important aspect of the body that we worry about is the brain. Circulation to the brain is vital. It is the system in your body that without which you just can't be yourself. And unfortunately, when someone has a cardiac arrest, the first thing that gets compromised is the brain. So within minutes, you can have damage to the brain. And that's one of the reasons why it's really, really important to make sure that we get that circulation going to the brain as fast as we can. It's also very important that there's times when modern medicine is excellent. We're able to bring people back very, very well. We're able to keep their heart going, keep their lungs going. But unfortunately, the brain, we still don't have much that we can do once the damage has occurred. So that's what makes it really important for us to talk to our loved ones, talk to them about our wishes in case we have brain damage and we can't make decisions. Do we want our bodies to keep on going with ventilators and life support machines?
So once somebody gets cardiac arrest and if he is not or she is not revived within certain time frame, what is that time frame to prevent the brain damage?
Minutes. So depending on your circulation, it could be anywhere between 1 and 4 minutes.
So between 1 and 4 minutes, they have to be revived.
Yes.
To prevent
Absolutely.
the brain damage.
Or at least, even if you can't revive them completely, at least take measures that will help keep the blood flow going to the brain.
Okay. So to prevent this brain damage, what should one do when we see somebody collapsing right in front of our eyes?
So the most effective thing that you can do, and one that requires the least amount of training, is doing CPR or cardiopulmonary resuscitation. Those are the actions that you see a lot of people jumping on the chest and compressing on the chest. That is, it's easily trained. So you can take a half-a-day class, do a one-day class, learn about CPR. Unfortunately, only 30% of the people that people actually see fall and lose consciousness and have a cardiac arrest actually get CPR.
40% only.
30%.
30%.
So only 1 in 3 people that actually have a witnessed cardiac arrest get CPR. And a lot of that has to do with us not being trained well enough, us as a general population.
So how does the CPR or cardiopulmonary resuscitation work? What is the mechanism?
Yeah, so very good question. So one of the things that the heart does is pumps blood that goes up into the brain, that goes up to the rest of your body. And what CPR is doing, because the heart itself's not pumping, what you're doing is you're compressing the heart so that the blood that's in there will pump over to the vital organs of the body, especially the brain.
Now, only trained people can do CPR or anybody can do it?
Absolutely not.
Like if I have not taken a CPR class, can I do it?
I think one of the things, ideally you should have a CPR training, but even if you don't, it's been shown that even if you just press on the chest.
Just keep on pressing?
Just keep pressing on the chest. It's a little bit, so if you take a look at your chest bone, which goes from the top to the bottom, you get right to the bottom. You go a little. You put the bottom of your hand right on the bone, and you just press on the left side of that, and you keep doing that.
How long one should do?
Just keep doing it till the emergency medics get there.
Okay. Now, so first thing should be dial 911 and do CPR or do CPR first and call?
No, absolutely. So dial 911, put them on a speakerphone. Most of our devices now have speakerphones. Put them on the speakerphone and start doing CPR.
CPR, as long as you want to do it.
You keep going till the paramedics get there.
Okay. Is there any alternative method other than the CPR?
So in public places, they have what's called automated electrical defibrillators. Automatic external defibrillators, AEDs. The AEDs are devices that we can use for shocking someone if it is a shockable rhythm. So if you do a CPR course, it's very easy because they teach you how to use these AEDs. They're available in most public places, in our malls, in the gyms, at the airports. So they're available. It's just that someone has to know how to use them. Most of the people in these public places, so the security guards and everyone, have CPR training, so they're able to. But if they don't, it's very important for us to be able to do that as a layperson.
Now, to go to the CPR training, do we need any qualifications or?
Absolutely not. My daughter, excuse me, my daughter who's 11 years old, she's done her CPR course, and I think it's very important for every one of us to do it.
And where do they get the information about the CPR course?
So there's a few places in Thunder Bay. One of the most popular one is the St. John's Ambulance, and they do CPR. I remember taking a course with St. John's when I was 11, and so they've been around that long, and they do a fantastic job.
So it's a half-day course of CPR, but can save a life of somebody else.
Absolutely, it can save life of a loved one, most importantly, and then including strangers.
We'll take a short break and we'll continue our discussion.
Sounds good.
Please
Thank you.
stay back for the last portion. Thank you. Welcome back to the show Talk with Your Doc. With us is today Dr. Zaki Ahmed, and we are talking about cardiac arrest. Dr. Zaki, you were mentioning about CPR, cardiopulmonary resuscitation, and everybody should get the training about the CPR training. Now, is the treatment same for the children, or is there any difference if the children get the cardiac arrest?
Yeah, absolutely the same. So whenever you see someone who just lost consciousness and does not have a pulse, there's a few places to check for a pulse. You can either check for a pulse at the jugular, which is right at the angle of the jaw. And if you can't, then just in the groin, you can feel it. The pulse on the hand is often, it's not always predictable, but these two sites are fairly good. But if you can't, and this is the site that you know of, that's the one you go with.
So if you don't feel the pulse, start doing, first call 911 and then do CPR.
Absolutely. So if you can get someone else to call 911, do that. So you get, you call out, you direct that to a person that you're seeing. You say, you, please call 911, and you start CPR if you know how to do CPR. Even if you don't, just chest compressions to the left side, just to make sure that the blood keeps circulating.
Now you mentioned when the paramedic comes or a person who are trained in CPR, they give the shock.
Right.
Now, what is the shock treatment? How does it work? And what are the complications of this treatment?
Yeah. So, so one of the things that if you see someone and you're in a public place, someone will try to do is go get an AED. And that's the other thing. If you're in a public place and someone collapses, you tell one person to call 911 and someone else to get an AED. If there's only one person, make sure you get them to call 911 and get the AED. Once the AED is available, that it's actually a very foolproof way of using the machine. It actually has all the directions right on the box. You put the pads on, the machine talks to you, it tells you what to do next. So it will, as soon as you turn it on, it will tell you where to put the pads. You do what the machine tells you to, and then it will analyze the rhythm of the heart that the person's heart is in. Once it does that, it will advise you whether to deliver shock or not. And if it advises you to deliver a shock, it will ask you to step away, delivers the shock, and then you continue your CPR.
Now, once a shock is delivered as per the instruction by the machine, what are the complications to the person who is receiving the shock, like a patient?
So you're essentially dead when you're having a cardiac arrest. So the risk of complications is very, very low. The device, that's when it's placed, is actually fairly foolproof, so it will not shock you if you're not in a shockable rhythm. So it prevents you from that. There are some people who may experience some burns, things like that, very minor cosmetic burns, but they're not permanent.
So how many patients with the cardiac arrest after receiving the shock or the CPR gets revived? What is the percentage of revival?
It varies. So it used to be, and it really depends on what revival is. So one of the biggest challenges with cardiac arrest is brain function. If you can't maintain brain function, then you can revive all the people that you want. So the most important thing is brain function. In terms of numbers, so about 40,000 lives can be saved just by using AED devices.
Wow, that's a big number.
Absolutely.
So we should know how to use the AED probably.
Absolutely, and that all gets taught in a CPR course.
Right. Now, once somebody is saved from the cardiac arrest and goes to, what happens next then?
So what would usually happen as soon as someone's revived, or even if they're not, they will be, the paramedics will try doing the CPR right there and try to get them revived right at the site. And if they can't, they will still get them to the emergency room. In the emergency room, the emergency physicians will also do the exact same thing. So they will continue. They have both the paramedics and the emergency physicians have slightly higher training than a regular CPR course. So this training tells us how to analyze the rhythms and what to do for each rhythm separately. And there's protocols that are called advanced cardiac life support protocols that we follow that will allow us to resuscitate the patient in the most effective way.
So do they have to be in the ICU for a certain time after?
Yeah, so once they're revived, it's almost always where they end up in the ICU.
ICU.
So intensive care units are specialized areas. We have now, as I said, the brain function being the most important. One of the things that we may do is cool the body down. So as we cool the temperature of the brain down, the brain's metabolism slows down, and the damage to the brain is a little bit lower. So this has been proven over the last 10 years to be very effective, where we initially started off with just one type of rhythm. Now we've expanded it to as many as we can.
So how many days one has to be in the ICU after revival?
It really varies. If you have a good outcome, or if you do very well, you may be in the intensive care unit for 2 to 3 days.
3 days.
And if you're fairly dependent on life support, and if you're not doing very well, if you've got damage to organs, then you may be there longer.
So once he's discharged from the ICU, what are the next steps should be taken to prevent the next cardiac arrest?
So the most important thing is to make sure that it doesn't happen again, if there's anything that caused it, to get rid of the cause. So if it was coronary artery disease or a heart attack that caused it, then to go back to try to determine if we can open up that vessel that's caused the cardiac arrest. Whether we open it up by doing an angiography or whether we open it up by doing surgery, that's the most important. If it's because of an abnormal rhythm that occurred, then the abnormal rhythm can be, we can implant devices called AICDs, which are devices that we can place which help prevent any deterioration of that rhythm. So if that rhythm occurs, it gives you an internal shock, so similar to what an AED did, but it gives you an internal shock which is very, very small, and you don't necessarily have a lot of pain with that.
And have a follow-up with the regular follow-up with the cardiologist?
Absolutely. So if it's a cardiac cause for the cardiac arrest, then you should definitely be following up with the cardiologist.
Thank you, Dr. Zaki Ahmed, for coming for the show and guiding us about the cardiac arrest.
It was a pleasure. Thank you.
Thank you, everyone.